Hello everyone, myself Arshil Malek, and today I'll be sharing my personal philosophy of caring. My understanding of care comes from two main experiences: working as a registered nurse in a hospital setting and caring for my grandfather during the final stage of his life. Together, this experience helped me understand that caring is not just about clinical skills or completing tasks, but it's more about how we support people during some of the most vulnerable moments of their life. Today, I'll briefly talk about my philosophy of care, the experience that shaped it, and how it influences physical, emotional, and psychosocial outcomes. To begin with, my personal philosophy of caring is based on treating each and every individual with compassion, dignity, honesty, and respect, regardless of their condition or level of independence. Working in a hospital taught me the most important that safe, timely, and professional care is utmost important, but it also showed me that completing tasks alone is not enough. True caring means recognizing that every client has their own emotional needs, preferences, and a sense of identity that must be respected. For me, caring means being patient and present, respecting privacy and personal choices, communicating clearly and honestly, supporting both physical and emotional needs. I believe that when caregivers approach care with respect and empathy, clients tend to feel more safe, comfortable, and it helps to build trust. Now, I'll be sharing my personal experience that shaped my philosophy. The experience that strongly shaped my philosophy of care was caring for my grandfather, who was unfortunately bedbound and was diagnosed with stage 4 cancer. During this time, he experienced severe pain, emotional distress, and loss of independence. I assisted him with daily activities such as feeding, bathing, repositioning to ensure his comfort. While my nursing knowledge helped me to meet his physical needs, I quickly realized that what helped him most was how I cared for him. Throughout his life, he was an independent individual who didn't like to be a burden on others. While being bedbound, he felt helpless and agitated for relying on others. However, when I spoke calmly, took my time, and listened to him, he became noticeably more relaxed. Even a small action like explaining what I'm going to do, respecting his preferences, made a huge difference. This experience taught me that caring is just not about completing tasks, but it's more about being present. It also motivated me to pursue the personal support worker program so I can continue to provide person centered care. Now, I will share how my philosophy impact client outcomes. There are three outcomes such as physical outcomes, emotional outcomes, and psychosocial outcomes. Firstly, physical outcomes. My philosophy supports physical well being by prioritizing comfort, safety, and dignity. For example, when caring for my grandfather, I was focused on proper positioning, gentle movements during his personal care. I paid very close attention to his comfort and adjusting my approach as needed. As a result, he experienced less discomfort and relief from pressure shows. This taught me that being respectful, providing patient care can greatly improve physical outcomes. Secondly, emotional outcomes. Emotional well-being is closely connected to how care is delivered and how we care. There were several times when my grandfather felt anxious or overwhelmed. However, instead of rushing, I listened to him, reassured him. After receiving emotional support, he was calmer and able to feel a lot better. This taught me that emotional care helps reduce anxiety and make clients feel more supported and understood. Lastly, psychosocial outcomes. Psychosocial well-being involves maintaining dignity, independence, and self-worth. Even though my grandfather was very ill, I involved him in small decisions such as choosing his routine, whether he would like to have his bath in morning or evening. These choices helped him feel respected and maintain a sense of control during difficult times. Moreover, there were times when I motivated him to promote independent feeding rather than relying on others. As a result, this helped him to promote independence and boost his confidence and self identity. To conclude, my personal philosophy of caring is shaped by both personal experience and professional experience. Caring for my grandfather taught me that caregiving is just not about physical tasks or completing more tasks, but it's about emotional presence, respect, and human connection. This philosophy guides how I support physical, emotional, and psychosocial outcome, and it is why I choose to pursue the personal support worker program. I want to continue making a difference, to be more precise, meaningful difference in people's life throughout compassion, person-centered care. Thank you for listening me.